Hi, this is Dr. Rob Komenarek from the Alpha Male Medical Institute. Do you know the #1 silent killer of both men and women? Well, it's undetected heart disease. In the weeks before having a heart attack, 95% of people suffer from these symptoms. Do you suffer from any of these symptoms, such as unusual fatigue or sweating, shortness of breath, neck or shoulder pain, sleep disturbance, indigestion, chest pain, weakness, difficulty walking upstairs or out to the mailbox, feeling lightheaded or passing out, or having that feeling like something bad is about to happen? At the time of a heart attack, people commonly have symptoms of shortness of breath, chest pain, weakness, and fatigue. And in women, sometimes they don't have any chest pain at all. Their major complaint is only fatigue. Other symptoms that you can have at the time of a heart attack are upper abdominal pain, abdominal fullness or abdominal burning sensation, nausea, neck, back, or jaw pain, or a feeling of impending doom. As we age, the prevalence of heart disease increases substantially each decade. On the slide on the left, you can see disease growing in an artery called atherosclerotic disease. And on the right, you can see by each decade, the incidence of heart disease increases dramatically. This heart disease is growing silently each decade. If you look at this slide here, the picture on the left shows the cholesterol plaque building up in the artery at about the 5 o'clock position. And over time, as the disease advances, you can see how the cholesterol deposits growing over time. That's a silent threat growing ever so deadly in your arteries. This heart disease grows silently each decade. This heart disease is quietly waiting to strike, and in this picture on the left, you can see the cholesterol deposit with this very thin fibrous cap over top. And on the right is that thin fibrous cap having ruptured, and this sudden plaque rupture is a heart attack. Well, get this, over 50% of people having a heart attack have so-called normal cholesterol. So what can you do to detect silent heart disease? At the Alpha Male Medical Institute, our heart disease prevention and genetic testing health evaluation can help to identify hidden active cardiovascular inflammatory disease that can make the difference between life and death. Standard cholesterol testing and outdated risk assessment scores will not discover your silent heart attack risk. Over 50% of all heart attacks happen in individuals with this so-called normal cholesterol. That means 1 out of 3.5 men and 1 out of 3 women will die from heart disease. This makes it the #1 killer of men and women alike. At the Alpha Male Medical Institute, our heart disease prevention and genetic testing program includes specialized laboratory. We do nuclear magnetic resonance lipoprotein particle testing, not calculated tests. We take a close look at your inflammation oxidation profile, your myocardial stress profile, your lipoprotein genetics, coagulation genetics, renal genetics, and your metabolic profile. We also perform what's called a carotid ultrasound with CIMT. This is a new non-invasive ultrasound test that's being recommended by the American Heart Association and the American College of Cardiology to screen for hidden heart disease in apparently healthy individuals. This is a non-invasive test which is performed with high-resolution B-mode ultrasound. This test is safe, painless, takes only about 20 minutes. And after we apply this conducting jelly to your skin, over your neck, a small handheld transducer is applied to image the carotid arteries. The ultrasonographer measures the combined thickness of the intimal and medial layers of the carotid artery walls, and we can tell if you have hidden active disease. The next test we perform at the Institute is called the VENDUS test. It's a non-invasive diagnostic device used to measure the vascular reactivity, and it detects early cardiovascular disease. So how does this VENDUS test work? The VENDUS test begins with an automated blood pressure measurement, followed by cuff occlusion in the right arm. And during the occlusion, which lasts about 5 minutes, the fingertip temperature in the right hand falls because of the absence of warm circulating blood. Once the cuff is released, the blood flow rushes back into the forearm and hand and causes temperature rebound in the fingertip, which is directly proportional to the vascular reactivity. The greater the temperature, the greater reactivity, the healthier the intimal layer of the artery. Why get tested? Because prevention is the best treatment, and cardiovascular disease develops over many years, and if left undetected, it can have life-threatening consequences. Initially, this is a silent process, which is why it's often called subclinical atherosclerosis. Vendus testing, which provides you with a quick and easy way of determining if you're heading down a road towards a heart attack or stroke or other cardiovascular disease. Vascular dysfunction of the artery is considered to be the earliest clinically detectable stage of subclinical atherosclerosis. Vascular dysfunction caught early is reversible with treatment. Next, you get an open-ended consultation with me. After your non-invasive, comfortable, and private in-house testing, we review your personalized heart attack risk based on your specific findings and an assessment of your current health profile with appropriate recommendations and referrals for any additional testing that may be required. Your life, your health, and your importance to your family is priceless. Spend the time today. Learn more about cardiovascular disease and what you can do to stop it. This has been Dr. Rob Kamenerick from the Alpha Male Medical Institute, and I wish you all the best in your health and wellness.